we are actually being lied to in so many different ways. The pharmaceutical companies advertise. Anybody ever see an advertisement for a drug on TV? What are the end side effects that they list at the end? Death, right? So one of my beefs with this dependence on pharmaceutical drugs is that it starts making us take less responsibility because we can just solve things with a drug. Just like this gentleman in the cartoon, he's going to eat whatever he wants to eat at his fast food restaurant and ask his doctor to supersize his cholesterol medication. Now the reason, of course, that this is happening is because of the profit margin of pharmaceutical drugs. They are the most profitable industry on the planet, and there are several pharmaceutical lobbyists for every member of Congress. And so I don't see relief from drug prices affecting us anytime soon. So again, Lipitor has made over $12.5 billion for its stockholders. And of course, one of the things they do is engage in misleading ads. These ads are designed to mislead both physicians and patients. Unfortunately, doctors do not take courses in statistics in medical school. It's not part of the curriculum. So they are ill-prepared to deal with these slick, glossy ads that come at them from drug reps who, of course, are gorgeous. You know, the definition of a drug rep is a very attractive member of the opposite sex. The drug rep brings in meals and pens and gifts, and the doctor falls for it, hook, line, and sinker. So I'm going to show you how this ad is misleading and hopefully start to spark some cynicism in your mind about drugs and their ads. So this says that Lipitor reduces the risk of heart attack by 36%. Now, if that were true, I would have everybody on Lipitor because heart disease is our #1 killer. But let's look at the fine print. If you follow that asterisk down here in the corner, it says that means in a large clinical study, 3% of patients taking a sugar pill, which is placebo, had a heart attack compared to 2% of patients taking Lipitor. How did they get 36% out of that? Well, 2 divided by 3 is basically 2/3. 1 minus 2/3 is 1/3. So it's basically expressing something as a percentage instead of raw data. If you look at the absolute risk reduction, what is 3 minus 2? 1. So the real reduction is only 1%. Now, I could live with that 1% if these drugs were cheap and if they had no side effects. Do all drugs, by the way, have side effects?
Yes.
They do. Let's look at some of the side effects of the statin drugs. This is a partial list. There are over 300 adverse effects, including death. Well, let's look at these. Diabetes, peripheral neuropathy, increased risk of kidney failure, congestive heart failure, memory loss, brain fog, liver, Parkinson's, ALS. It reduces your synthesis of thyroid hormone, which is really ironic because low thyroid can cause high cholesterol. If you get put on a statin drug, now your thyroid's even worse. So you've just added insult to injury. It reduces production of testosterone as well as vitamin D, but it is the most lucrative drug worldwide and under new guidelines. And by the way, the physicians who created those guidelines are on the payroll of the statin drug companies. Does this seem like a closed loop? Should that even be allowed?
Yeah.
At any rate, the majority of men and women over the age of 60 qualify to be on this drug. So one of the things I do with people is help them get off drugs that don't have much value, and this is one of them. Another drug that I'm really anti are the proton pump inhibitors. Have you heard of things like Dexilant, Prevacid, Prilosec, Nexium? You heard of those drugs? Well, the averages are there's somebody in this room on one of those drugs. So those drugs completely destroy temporarily your ability to make stomach acid. And so they can alleviate some side effects for you, but you just struck a bargain with the devil because in the long run, they increase risk of stroke, heart attack, osteoporosis, kidney failure, and that most feared one, Alzheimer's dementia. So one of the things we do in this clinic is we show people how they can get by without needing these drugs simply by paying attention to the fundamentals, the basics of what creates good health. I routinely help people get off this medication because I don't want them suffering from those side effects. What about other drugs? Calcium channel blockers, this would be amlodipine, otherwise known as Norvasc. There are others in that class. Possibly increases risk of breast cancer, possibly doubles the risk of pancreatic cancer. Popular antidepressants, Prozac, Celexa, might cause low bone density. Metformin can cause neuropathy. Insulin and glucoside increase your risk of heart disease. Aspirin and NSAIDs increase risk of heart disease and stroke. Benzodiazepines, possibly Alzheimer's, that would be lorazepam, Valium. And of course, we know the controversy over the overuse of pain medication, the opioid crises, etc. Speaking of, that was a huge criminal blunder by OxyContin. You might have heard of that pain medication. They told doctors it had less than a 1% chance of causing addiction. In reality, it was a 50% chance. So again, purposely misleading doctors in order to make a sale. So is this drug-centered approach actually helping us? Not if you look at the statistics. We are ranked 50th out of 55 countries studied in terms of our overall health outcomes. But we're spending more than any other country. We're less than 5% of the world's population, but we're taking 65% of the world's drugs. We're a gold mine for the pharmaceutical companies. And we have the most expensive drugs in the world. Other countries put reasonable limits on drug costs. Not in the US. It's a free market economy, and whatever they can gouge us for, they will. Think of the price of EpiPen, for example. I could go on and on about the price of drugs. We're still getting sicker and fatter, and rates of all chronic illnesses are going up. And depending on how you interpret the statistics, medical care itself can be a cause of death, either due to side effects of medication, overtreatment, amputating the wrong limb, hospital error, etc., etc. So it really behooves us to try to figure out how to stay healthy so we don't get trapped into that system. So again, we have a 1.5 trillion healthcare annual expenditures. So a lot of people are waking up and they're realizing that, hey, they have options, they have choices. Maybe something out there that's considered alternative or complementary may have some benefit. And so we're now spending $30 billion out of pocket for things that insurance does not cover. And by the way, a lot of what we do at this clinic is not FDA approved. And so we actually now have people sign paperwork. We know that our therapies work very well, but we now have to let people know that what we do here is not necessarily FDA approved. The FDA is very slow to approve certain things, and a lot of their approvals depend on being drug-centered. So if you look again at medical costs for common procedures, open heart surgery, a mere $225,000, knee replacement, $65,000, appendectomy, $45,000, and even if you had your big toe amputated, $12,000. If you just walk into an emergency room and have a few simple tests, one visit and walk out, you're on the hook for $5,000 at least. So again, the leading cause of bankruptcy today are medical costs, and a third of those have health insurance. So it's the co-pays that will get you. It's somehow ending up in an out-of-network place or having an emergency somewhere. And so there are horror stories about people not able to cope with huge medical costs. We spoke earlier about drug costs. Here are some terrible examples. And most of these drugs, this one is for hepatitis, and this one, of course, is for ED. The rest are all for autoimmune disorders. So autoimmune disorders are where your immune system is for some reason attacking you. So things like MS, psoriasis, rheumatoid arthritis, these are common autoimmune conditions. The medical establishment takes the view that these diseases are mysterious. We don't know what causes them, but we're going to attack it by suppressing your immune system in hopes that you'll get better from that disease. That's again another bargain with the devil, because when you suppress the immune system, you can get cancer, tuberculosis, death, a few kind of bad side effects. But look at the cost. These are monthly costs, NRED, almost $5,000. Hepatitis C treatment, $84,000. Who can afford this? This is partly why our insurance rates are going up and up and up. And by the way, that hepatitis C drug, if you were to go to India, you could get it for $1,500. So we are being literally gouged by the pharmaceutical industry in hopes of ever higher and higher profit. Even Viagra, $70 a pill. What right do they have to limit how many times you're going to have relations with your spouse? I mean, that's getting a little too personal. So again, we can get really angry over this, and if I allow myself, I can get really angry about this, or I can take the approach, hey, what if we could show people here how to get so healthy that you really don't need those medications? And that's what we do here. I've gotten people off so many different medications, this list as well as much bigger lists, so I'm now known as that doctor who helps people get off medication. And then we have discretionary medical spending. It's really interesting what value people will put on aesthetic and cosmetic versus medical. We were even talking earlier today about a woman who chose to ignore a cancer in lieu of getting a facelift. So again, people have priorities, and sometimes how people look is more important to them than their health. But I kind of point this out because a lot of folks do have money for discretionary medical spending, they just need to be a little bit wiser on how to allocate it. So a lot of what we do here, unfortunately, because it is considered by the FDA, still considered experimental, a lot of what we do here is not covered by insurance, but people get tremendous value over following our protocols and so forth. So one of the reasons insurance doesn't pay is that in order for a drug, for example, to be labeled as therapeutic, it has to go through a clinical trial. Clinical trials can cost up to $1 billion. If you've got something natural, you can't patent it. Therefore, nobody could afford to do a clinical trial on a natural substance because they can't have exclusive rights to that. Does that make sense? So things like natural progesterone, which the human female body produces, is much healthier for you than synthetic progestins, but you can't patent it. So it's only been fairly recently that you could get natural progesterone from a regular pharmacy. So again, insurance won't cover experimental or natural treatments, even when we see anecdotally over and over again that they work. So this is actually just showing you the difference between natural progesterone and synthetic. Even a fourth grader could pick out the differences. They are not equivalent molecules. And even though all three of them work to protect the uterus from the impact of estrogen, so these are estrogen balancing hormones, only progesterone protects against breast cancer, blood clots, heart attack, and stroke. The other synthetic progestins make those outcomes more likely. Higher risk of blood clot, breast cancer, stroke, and heart attack. So why would anybody use the synthetic versus the progesterone? Because there's no drug rep coming in the door to promote natural progesterone. Doctors are human. They're going to listen to the people that make the most noise repeatedly, and so they end up prescribing the synthetics because that's what they know. I had no courses in medical school on natural hormones. I was taught synthetic, and that's what all physicians are taught. So the World Health Organization has even gone on record that's stating that our current approach, which is largely this pharmaceutical approach, is really not helping us. 90% of our illnesses prevalent today are not treated correctly with this insurance-based, medication-based medicine. So when you think about our healthcare system, it's almost like a funnel has been created. The first thing is, I have some symptoms. What condition do I have? Now you've received a diagnosis, and after that diagnosis, you're placed on a drug. It's a foolproof system to keep us all sick and dependent on drugs. What's the number one website that you would go to if you're not sure what your symptoms are? WebMD? Did I hear somebody say WebMD? WebMD, wild guess, who do you think funds WebMD? Pharmaceutical companies. So there was even a survey a few years ago that at the end of the survey, it said, it sounds like you have depression, you need to go see your doctor. It was rigged. No matter how you answered it, it still came up with the same statement. No surprise, it was funded by Eli Lilly, and they make the drug Cymbalta. So again, you even have to be cautious about what you're reading on what seems like a very consumer-friendly website, because you can get tainted information designed to funnel you into getting a drug answer. So I used to say, Mrs. Jones, you're depressed, you have diabetes, your cholesterol's too high, you're going to need Prozac, metformin, and Lipitor for the rest of your life. That's because I have been brainwashed. I no longer say that to people. Thank goodness I got out of that little box. I now have lifestyle and hormone and supplement and other things that I could help people with to where they can reverse those symptoms and be healthy without depending on all those drugs. So we're going to talk this evening about the cause of poor health, understanding hormones because they play a big role, lifestyle factors, and then how can we put it all together? So the number one thing is we have to remind ourselves to take responsibility. You remember the cartoon about the guy who's going to supersize his Lipitor? That's not taking responsibility. How many of you own dogs? Any pet dogs? Okay, what do we have to do for our dogs every day besides food and water? Walk them. Now, what if you walked your dog this way? So the pet is getting exercise, but the humans certainly are not. So again, we have to step up to the plate and recognize that our health habits make an impact on our health. Here's another thing. Besides exercise, we need to be eating real food. The dictionary definition of real food, that which is eaten to sustain life, provide energy, and promote growth and repair of tissues. Our cells are constantly being broken down through a process called apoptosis, and they should be replaced with new healthy cells. To the extent that we can replace those with new healthy cells, that's the extent that we remain healthy. You can't do that if you don't provide the right substrate, and that's what we put in our mouths and swallow. So thinking of this dictionary definition of food, the last time you swung through a McDonald's or a Dunkin' Donuts, were you really eating food? Think about it. No, you were not. Have you ever seen those pictures of a McDonald's hamburger and some French fries taken 5 years later and they look the same? Real food rots. It doesn't just stay in a preserved state year after year. It's shown that the closer you live to a cluster of fast food restaurants, the higher your stroke rate. It's almost like floats through the air, the risk. In reality, fast food restaurants are convenient. People swing by, and that food is likely to have a poor health. Speaking of hormones, there are hormones that help us burn fat, and there are hormones, if they are out of balance, could potentially help us store fat. So we're going to talk a lot about testosterone, thyroid. We're also going to talk about a little bit about insulin, a lot about estrogen and cortisol. We need these hormones, we just don't need them to be out of balance. They're necessary for feeling good and for quality of life, but we don't want them to be out of balance. Have you ever felt really bad? You went to your doctor, he or she ran a standard panel of labs and said, "Good news, Mrs. Jones, your labs are all normal." If you don't feel good, is that really good news? Not really, it just makes you frustrated. And my assessment is that either not enough laboratory tests were done or functional lab ranges were not used when interpreting them. So lab ranges from Quest or LabTech or LabCorp, they're based on what's called a bell curve, which is simply a statistical 95% of the population. not everybody has the same optimal zone. So if you're at the tail end, the low end of those numbers, that may not be optimal for you. So through my training in functional and integrated medicine, I've learned how to reinterpret lab tests to a tighter, more narrow range. And I'll show you an example in just a second. But again, I also mentioned inadequate testing. It's very important to test for all the different things that could cause symptoms instead of just looking at a few. So again, this highlights the need for testing. Every single one of these disorders has fatigue as one of the presenting symptoms. So if you're tired and you don't know why, it's imperative to try to figure it out and not just guess. So we have a saying around here, we don't guess, we test. So here's an example of free T3, which is a thyroid test. And the lab says it can be anywhere from 2.2 to 5.0. That's rather a broad range. It doesn't make a lot of sense that you're going to feel as good here as you do here. And indeed, we've tightened that up. We know that the T3 should be in a much tighter range in order for that person to feel good. So speaking of thyroid, tremendous amount of control is exerted by your thyroid gland. It sits right here below the Adam's apple, and from this vantage point, kind of like the king on the throne, kind of controls the metabolism, the rate at which you burn energy. So if your thyroid is low functioning, it could possibly affect your immune system. You might catch every cold that comes through. Your brain and nervous system, you might feel depressed. Your GI function, you could be constipated. Fat burning, you might not be able to lose weight or burn fat. Healthy cholesterol levels, we've already mentioned that. And even producing enough stomach acid. And interestingly, a lot of times low stomach acid is misinterpreted as high stomach acid, and that's when people are put on the PPI drugs that we saw that were so damaging. So this is kind of how the system works. The pituitary sends a signal called thyroid stimulating hormone, TSH, to the thyroid. Under proper conditions, the thyroid responds by making thyroid hormone. The thyroid makes two types of thyroid hormone. It makes T4 and it makes T3. T4 is the inactive version. It has to be converted into T3 before it's actually active. So the conversion takes place either in the liver, the gut, or in other peripheral tissues. And your body is supposed to be able to convert that as it needs it. But what if you don't have some of the cofactors, such as zinc, selenium, iodine, vitamin D? These are cofactors in order for the T4 to convert to T3. Or what if you're under a lot of stress? Any of those situations can make the system go awry. And so if your gut is in poor health, or your liver's in bad shape, or maybe genetically you just can't make the conversion, you can have a perfectly normal TSH, a perfectly normal T4, but still be hypothyroid because you're not converting it to T3. Or if you're under a lot of stress, you could be converting it to reverse T3. Anybody heard of reverse T3? So reverse T3 is the inactive version of T3. So it's kind of complicated. So a true thyroid test should be measuring for all of those factors. So I'm going to give you an example of why that's so important. And it involves my husband, whom you just met. So we've only been together 3 years. We met 3 years ago this month. And like most modern couples, we met on the internet. After we met, we started, of course, sharing our health histories, and he told me that he had Hashimoto's thyroid. Everybody heard of that? It's an autoimmune thyroid. And a few other things. And he said he really didn't feel that great all the time, but he reassured me, my thyroid is fine, I'm on the right medication. I have been under the care of several different internists and endocrinologists, including a neuroendocrinologist from Duke University. So I'm fine. But as we got to know each other, in my mind I'm thinking, you know what, I'm not sure he's fine as far as his thyroid. So I finally persuaded him to go through all the testing that I do. So this is what he looked like when we met. And when I tested him, he had the lowest T3 I had ever seen in my entire professional career, and the highest reverse T3. So none of his T4, and he was on hefty doses of Synthroid, which is 100% T4, very little to none of it was getting converted to T3. So he was clinically severely hypothyroid, and all of those excellent clinicians had not tested him, therefore they failed to pick it up. So we also tested his testosterone, and I helped him convert to a healthier diet, and voila. So how many women get to sort of remake their husband, right? So he's in much better health, thanks to some hormonal improvements, some lifestyle changes. So he's kind of a good advertisement for what we do here.